Starting.
I think I fixed it.
Hello, hello, and welcome everyone. Wow, we're right on the money. Dr. Myron runs a tight ship, I'll tell you. We're on time here. We're going to give people a chance. This has been, I don't know what it is. It's like back to school. Everybody wants to learn. We've just blown the doors off the registrations to this very special master class. This is not a webinar where you're just sitting and listening and you're taking down a few notes or so. This is a master class. Dr. Myron is going to provide to you is some enlightening information, but more importantly, he's going to empower you, okay, to take the PRF EDU tools and apply them directly into your practice. This is an implementation session. Okay? You're going to leave here tonight. In addition to some lucky winners, are going to get some prizes. We teased that out, but it's actually true. At the very end, if you behave yourselves well, if you chat in the box, for example, the first question of the night is, who are you? Where are you from? Okay, and why are you here? Let's see if we can get a few answers. We'd love to know, who are you, where are you from, and why are you here? Okay, so good behavior tonight earns you an opportunity to win some prizes. And what's the favorite prize of every doctor? It's continuing education. Okay, so we're going to make sure that you get some of that. So I'm stalling a little bit here, but we're very excited for this evening. As I said, it is an implementation session. Among many things, aside from he gives great bear hugs, what I love about Dr. Myron is everything that he teaches and talks about, in addition to being regenerative, which is what he's known for, it is something that you can apply and use to everyday patient care. It's also something that if you get excited about it, you catch fire, you can take in your practice to a whole nother level. So tonight I want to tell you three things to listen for, and then I'm going to share with you a little bit about, okay, the man himself. Okay. So first tonight, I want you to keep your eyes and ears open and listen for the way that Dr. Myron presents PRF and facial aesthetics. PRF approaches for every practitioner. It can be applied in your practice. And by the way, even outside of your practice, wait till you see some of this stuff. Okay. But also, it can lead us to a facial aesthetics component, moving beyond just cosmetics or aesthetics or, the once in a while hodgepodge Botox into a full-fledged business system that drives cash-paying patients that refer, tell their friends, and buy smile makeovers. Okay, like you're going to find that this is the ultimate differentiation factor. The second thing is that it's highly profitable. Everything Dr. Myron does, he packs in a toolbox, in a playbook. Again, an implementable system. You don't have to figure out how to integrate it in your practice. He's going to help you to do that. So tonight you're going to get a crash course. Okay? It's going to make you decide. Okay, are you with us? Are you against us? Okay, are you going to jump onto the regenerative movement and dentistry and take your practice from ordinary dental clinic, okay, to more of a wellness, an aesthetic, okay, a concierge style practice? We're excited to find out. And then the third one, of course, the most important one is, hey, would you like to help more patients? The topic out there is holistic, regenerative, longevity. You have all these things. And Dr. Myron doesn't discriminate. Okay. He wants all doctors from all walks of life to come into our ecosystem, PRF EDU, and get the tools to take home and to up level the quality of patients' lives. And that's exactly what you're going to learn tonight. So, in every practitioner's life, there's a moment, often an educator, a mentor. There's something, okay, that inspires them, okay, that takes their mind and it just opens it, just like you do with your patients every single day. Now, whether you got the old school in the Panky way, okay, or maybe the Spears, or maybe the Coyce, okay, today it's going to be the Myron. And I'm here to tell you, I know this is probably old analogy now. I call him the Elon Musk of dentistry simply because in his heart of hearts, he's a researcher. He's an innovator. I prefer the words renegade, maverick. Okay, he bucks the trend. He sets higher standard of care, and he gives doctors, okay, ways to up level, okay, in your practice what you do. So today, my friend, a mentor to tens of thousands, the leading researcher in our industry in the entire world with the most published textbook in history. He gets that year after year. He's constantly innovating. He doesn't follow trends, he creates trends. As a matter of fact, you learned about one of them that you should have received just for registering for this webinar. He's also a generous minded teacher. And tonight you're going to see the power and the magic of Dr. Richard Myron. You're very smart to be here. Listen up and get ready because tonight can be the difference maker for the rest of your career. Dr. Myron, take it away. They're all yours.
Alrighty. As always, Scott, thank you so much for the introduction. And for people that I'm meeting for the very first time, welcome. It's going to be an exciting evening, and we're doing this for the very first time where we're giving some giveaways. But I also wanted to talk not just about science, but also the profitability of using platelet-rich fibrin in your practice and how care aesthetics can help you. It's something that we've grown to really I don't want to say master, but we've gotten pretty good at helping clinics introduce PureF in the dental space, obviously, but now in the facial aesthetic space. And I think there's really unique opportunities here for dentists, nurse practitioners, medical doctors to introduce some of these therapies. And we'll get going and talk about that. So as Scott had mentioned, I live and breathe research. It's really my passion. I think anybody that's attended any of our courses kind of understands that about me. I really love being in my research lab and trying to make things better for quote unquote, regenerative dentistry of the world. And this book really highlights how you can transition your practice into thinking a little bit more outside the box, what you can do as a dentist, how things have changed over the years, and how you can improve your practice and make it a lot more rewarding. Of course, I am a dentist just like everybody else. I did study my PhD in molecular and cell biology in Switzerland. I think when I moved to Switzerland in 2009, that's where I really met one of my two favorite people, Danny Boozer and Tony Schooley, and my PhD mentors. And working in the periodontal department there really taught me a lot about trying to improve care of patients. For those that don't know, the University of Bern, it's the number one ranking dental school in the world when it comes to citations per paper. Both of my mentors are very, very well known for the work that they've done. And of course, our research team, both on histology, cell biology, and translational research to clinical practice is very strong. So it was a great place for me to work. I always say, never forget that before you're ever going to touch a new bone graft, a new dental implant, a new PureF centrifuge protocols. They have to be tested in a research lab, just like this one here. And many of the tests are conducted and performed over the years. I truly believe as a researcher as well, one of the things that I don't particularly like a lot about, working in academics in the United States versus in Switzerland is that I found that a lot of researchers in our dental schools are PhDs, which is great. They're very educated, they're smart people, but they're not dentists. A lot of them are just PhDs per se. And I shouldn't really use the word just, but they don't know what it's like to treat patients and they don't know what it's like to work in a clinical practice. So oftentimes it's hard to build proper research questions that is really gonna improve patient care. So when I met Danny Boozer and Tony Sculian as a molecular and cell biologist, the train of thought was really changed. It was really more about, all right, you're a cell biologist. We don't want you doing any of that MAP kinase pathway type work anymore. We want you to focus on, how are you going to make the field of dentistry better? If you're a molecular biologist, find out ways that you can make allografts with more BMPs inside that's going to make bone faster for guided bone regeneration, or figure out if you're a cell biologist, how you can get more cells in platelet concentrates so this PureF is going to be superior. And so I started to change the way that I performed research, and everything then became in my research lab, how can we do a project that's going to affect real patient care in the next 3 to 5 years? And that's been the goal ever since. One of the things that I'm very proud of, Scott mentioned that, yes, we have had a lot of, best-selling textbook. In fact, this book here, Understanding Platelet-Rich Fibrin, was the most sold textbook in the world in dentistry 2 years in a row. Obviously, it's something I'm very proud of, but I think something that I'm much more proud of is the fact that when you actually look at expertise and when you look at research and we look at citations per paper, there's these independent organizations that calculate how many research papers do you have, what institutions are the leading, research facilities, what is the impact factor of these papers, all of these things get pooled, and based on how many citations your papers get, your publications, there's a ranking system. And when it comes to expertise in platelet-rich fiber, and the University of Bern's ranked number one, and myself and one of my best friends, Yufeng Zhang, are ranked number one and number two when it comes to research that we've done in this field. Um, and it started many years ago. I've had many mentors, many great people. I've had many colleagues that I've worked with over the years, from Bob Marks, who invented PRP, to even Joseph Chacroun, and expert clinicians such as Dr. Michael Picos, and just learned a little bit of what everybody was doing and trying to figure out, how can we utilize the body's innate ability to heal itself to help, healing outcomes. I always say the body is truly an amazing thing. And as a cell biologist, I always give the same examples. And, if you're cutting cucumbers in the kitchen and you happen to cut yourself, the fact that you can actually heal all by yourself is really an amazing thing, because your blood is liquid and you have the main clotting factors are fibrinogen and thrombin. And it's only when that gets exposed to air oxygen that starts a clotting process, and then cells and growth factors get trapped in the clot. And then over the next 21 or so days, you're going to heal. And amazingly, if you get as you get older, actually, you lose your ability to heal yourself, and a lot of it's related to blood flow. Your heart's not pumping as quickly. It's not your heart's a muscle, and it's not as strong when it was 70 as it was when you were 20. And all of these things start to decrease a little bit. And so it was actually Professor Robert Marks at Jackson Hospital in Miami. And he thought to himself, especially doing research on diabetic wounds and osteonecrosis of the jaw and burn victims, etc., that, hey, like in a diabetic person, this is a blood flow related problem. And most of the time, diabetics have issues at their extremities, so bottom of the feet. And unfortunately, with smaller blood vessels, you can't pump blood flow to that area as effectively. And so Bob Marks was one of the first people in the world to really draw blood from the patient, separate cells based on density, because we know the platelets are really the cells that help with regeneration. And you can take a 10 ml vial of blood and super concentrate all the platelets in 1 ml, and then use that for regenerative purposes. And he called the technology platelet rich plasma. And that became very popular in all fields of medicine, not just dentistry. And of course, many years later, modifications to tube technology and other things, removal of anticoagulants, led to this new technology called platelet-rich fibrin, which is often referred to the second generation platelet concentrate. And many studies have compared PRP to PRF, and all studies show PRF is superior, and that's really what's utilized in pretty much all fields of medicine today. Um, and of course, when we just talk very briefly about biology, the advantage of using your own blood to help you with healing is that we need blood flow in order to heal. Like if you think of yourself, there's certain things that are very intrinsically important for healing. A, the more blood flow you have to a defect, the better the healing is going to be. And that's one of the reasons why, for example, if you have a meniscus tear, it takes you so long to heal, because in your cartilage, you don't exactly have a lot of blood flow. So you don't have all these cells going in to help you with healing. And for that reason, healing is limited. And so I always say you have a blood flow related problem. And so we're introducing a blood flow solution to some of these defects. And the main growth factor that helps with blood flow is vascular endothelial growth factor. VEGF is the growth factor that helps with angiogenesis. PDGF is going to help with cell recruitment, and TGF beta is going to help with cell proliferation. And to very quickly go through medical applications, because I believe that a lot of this is very prolific when you see these things. This is a melanoma that was removed, and it had to be covered with a skin graft because the skin on this baby toe is very thin and not very elastic. So if it was a cancer on, some other area, there's a lot of people that get skin cancers right here in Florida because the sun shines down here. Well, they can easily remove the skin cancer, suture that closed, because there's a lot of elasticity in the skin and a lot of stretch there. Well, if you think of this area here, There's not a lot of stretch on the skin of your baby toe. And on top of that, this is literally the furthest place away from your heart, right? Your heart's on the left-hand side. This is your baby toe on your right foot. And so the surgical dermatologist did the skin graft hoping it would take. Unfortunately, it didn't. And when this didn't take, told the patient, this is all related to blood flow. There wasn't enough blood flow. And it was actually, came into, my arms basically. It was actually my next door neighbor. And I said, well, if this is all related to blood flow, we can treat these types of defects with Pure F. She was scheduled actually for an amputation, and we helped her with healing. And that's a very small case because a case like this one here, this is somebody's Achilles area, their heel, this is their ankle here. You can't see the toes in the front, but this is a extreme diabetic wound. It's now been infected. Typically, this is an amputation above the ankle, and we're able to treat these types of defects today with things like platelet-rich fibrin. And this is exactly what we teach in our 2-day course. We teach people how to spin properly. Well, of course, how to do phlebotomy in the first place, how to draw tubes. We teach people which tubes to use when, and we teach people which layers to draw the platelet concentrate from. And then we can create things, what we call here a biograft, which is a super concentrate of platelets and leukocytes. Here's an example of a Dr. Castropinto here, diabetic patient. You can tell based on how white their feet are. Inject around the periphery of this defect here, and then bring the biograft directly to the area, cover it with a nonstick gauze pad, and then amazingly, this is 3 weeks later on a defect that had not healed for 6 months, okay, and prevent another amputation there. And there's all kinds of cases that I run into where I have lots of colleagues. For example, this is a periodontist, a good friend of mine. In fact, I'm going to visit him next week. We're doing a course together in Houston, and his buddy ended up cutting his finger off doing woodwork. And when they went to the emergency room, said, this will never grow back. You're never going to have any feeling in this area. You're basically right on to bone. And you're lucky that, your finger didn't get caught up in there in the saw a little bit further. And sure enough, what, Dr. Ali did was he took a Pure F membrane and put it over. He's like, hey, listen, I've taken a lot of Pure F courses over the years, and I believe that this can help you heal. I'm not too sure how well it's going to work, but did a treatment, and this was the results 1 week later, 2 weeks later, and 1 month later. And amazingly, not only did it actually regrow back, but when you look at the defect, you can hardly even tell where there's no scars, which is quite incredible. And, this is just an ability for your body to heal itself. The medical doctor, when he went to the emergency room, told him you're going to have a shorter finger for the rest of your life, etc. The body is an amazing thing. We don't know how much we can push the limits of biology, but this is a very, start to what we can do by helping with, just increasing blood flow to the area to allow these patients to heal faster. Some of the most prolific applications of use of Pure F in the field of medicine is done by this gentleman, Dr. Robert Talick. He is the U.S. Olympic orthopedic surgeon, so he treats a lot of pro athletes. And, our research team created what's called the ALB Pure F. And for those that don't know what that is yet, it's basically a cooked version of Pure F, a denatured version. And the reason why we would do that is because regular Pure F lasts 2 to 3 weeks. So we could never use this as a barrier membrane in guided bone regeneration and periodontal procedures and implant dentistry. But if you actually cook the blood and denature the albumin, it takes the body 4 to 6 months to break it down. So later on, I'm going to show you guys applications where if you'd like to, you can completely eliminate the use of things like collagen membranes in many applications in dentistry. When Dr. Talick saw that, he thought to himself, well, I could probably treat things like very severe spinal tears. Usually, this would be a $120,000 surgery where they'd have to go into the back, cut the patient open, put a piece of polymer plastic over top of that defect. And today, he no longer does that. Today, the majority of the time, he's going to actually use this Al-Puref, which I'm going to show you. These are videos from our textbooks, but if you've never seen this before, after the blood draw, the platelet concentrate layer will go into the bioheat device, and that right there, it's basically a device that will cook blood from 360 degrees. It's cooked the blood, the platelet pore plasma layer. It's very hot then, and so we put it in a little device beside it that's called the BioCool just to cool it down. Now, the one disadvantage of using the cooking process is you can imagine that all the cells and growth factors will not survive that. So all of our great features of our standard Pure F, all the growth factors, all the cells are now gone essentially. They're denatured. But we've created protocols where we actually take on one side our standard liquid Pure F, and on the other side, our albumin gel is what we call it, that's denatured albumin that's going to last 4 to 6 months. And we're actually going to pass these back and forth using a female-female lure lock. And we're going to create a biomaterial that's going to last 4 to 6 months. And this is made all naturally. Um, we created this technology back in 2019. I've published a lot of papers on this. It's since been used as what we call biofillers in facial aesthetics. We're going to talk about how we can use this to replace Juvederm and Restylane. And we've also worked with certain companies like Easy Gel or Easy Cool. We white label those products for them in the field of facial aesthetics. Now, when Dr. Talek saw that, he said, well, I'm going to start using this material instead of doing invasive surgeries. And this right here is somebody's spine. So he's on the C-arm scanner. This is a scanner here. He knows exactly which angle he needs to enter from. And he's basically saying here, X-ray, X-ray, X-ray. He's going to enter all the way to where he needs to go. There's the needle where the spine, where the spinal tear was. And then he's basically just going to introduce the ALB Pure F, or AKA biofillers. And imagine, instead of doing a $120,000 surgery, you get a little Band-Aid, and this is literally 15 minutes after.
Straighten your knee. No pain.
No, okay.
Okay, the other leg. Perfect. Okay, and come back to me. Okay.
Okay, as I've shown in a lot of our courses, Dr. Talek treats a lot of professional athletes, and in fact, one of the most famous is Nelly Korda, the #1 golfer in the world. And golf is a very horrific sport for people's spine because they're always whooping around, whooping around. So a lot of them have a lot of spinal tears. And of course, Tiger Woods have had like 7, 8 surgeries now. And today, instead of doing those big spinal surgeries, they actually use Pure F to basically regenerate the spine. And Nelly Korda is probably the most well-known athlete, #1 golfer in the world. She actually won a gold medal in the Olympics and was on the cover of Golf Digest. And when she won the gold medal and was on the cover, she framed the cover for Dr. Talek, sent it to him in his office, and he wrote, "Dear Talek family," because his wife is a nurse that works with him, "You are the Pure F that holds us together." So it's quite interesting. We're going to talk about how we use Pure F in dentistry, but I mean, it's used in practically all fields of medicine. I can't think of a single field of medicine where you would not benefit from having more blood flow. And imagine when it comes to safety, our orthopedic surgeons or orthopods are literally injecting it directly into the spine of people with open tears. You can't have anything that's more safe than your own autologous tissues. And when you're able to super concentrate them, when you're able to manipulate the properties of the body through heating processes or cooling processes, etc., you can really start to help people heal without doing barbaric surgeries that we used to do, 20, 30 years ago. So we'll talk about this, and we'll talk about how we may not need to do big invasive facial aesthetic surgeries anymore, and facelifts and other things, because of the technologies that have been developed more recently, especially when we combine them with energy-based devices. So my team has really been, well known for the optimization of platelet-rich fibrin. We teach full courses, obviously, on how we do this, how we optimize it. Very simply, there's different types of tubes. We all know this. There's a solid Pure F tube that's meant to make membranes that we use in dentistry. They're hydrophilic, typically made out of glass. And we also have liquid tubes meant to make a liquid. And there are blue cap tubes, and they're typically made out of plastic, and they're very hydrophobic surfaces. And then we can do all kinds of things between making sticky bone and everything else. Everybody is familiar with this. I don't need to show these videos on how, we make membranes and we make plugs. And of course, when we optimize this, in dentistry, we can create, these bone grafting procedures where the graft material handling is significantly improved. Okay. And so I'm sure everybody in the audience is familiar with these very basic things, but don't forget 10 years ago when there was no such thing as liquid pure F, and we pioneered a paper called injectable platelet-rich fibrin for the very first time. We basically introduced a whole field that had never existed before by being able to create an injectable form of PRF or a liquid form that would actually clot and improve graft stability. And a lot of research been done over the years. I get a lot of credit to my lab mates. Masako was one of my favorite postdocs. She was with me in Switzerland and then moved from Switzerland to the United States with me and was one of my top postdocs of all time. But what Masako did, which was quite prolific in her research, in my lab, was figure out better ways to optimize growth factor release over time. And so from the year 2014 to 17, we spent a lot of time in the lab to try and figure out, this is TGF beta, this is growth factor release, and this is over time. And we could actually get 5 times more growth factor release simply based on the protocols that people were spinning at. And so there's been a whole evolution of the technology. I think a lot of people that have taken our courses in the last 6, 7 years all understand why they're spinning horizontal centrifugation. There hasn't been really a lot of improvement since 2019. My team's been responsible for a lot of the work in 2014 onwards on trying to optimize things further and further. And of course, in 2016, the big breakthrough paper that I wrote with Joseph Chacroun titled Injectable Platelet-Rich Fibrin, Opportunities in Regenerative Dentistry and Medicine was a very, very well cited paper. In fact, last year we just published the paper 10 years of injectable platelet-rich fibrin. It's hard to believe it's already been 10 years that the technology has been around. And of course, the ALB PureF has really improved a lot of procedures in dentistry and medicine. So, commonly, for those that would like to learn more about sinus grafting, we do a lot of work with Dr. Michael Picos. He's a very close colleague and quite honestly mentor and role model of mine, and he has been for a decade now. It's hard to believe I've known him for 10 years now as well. But, just a great surgeon. If you ever want to take a great sinus grafting course, there's a lot of great stuff that he's been introduced, that he introduced, a lot of protocols, actually, a lot of very good evidence-based protocols. And rule of thumb here, we typically introduce 1 PureF membrane per 2 cc's of bone. We found that ratio to be most effective, and we use it in pretty much all sinus grafting procedures. This is a great use of PureF. It's called the poncho technique. A lot of research has been published on this as well, and improvements of osseointegration. And we've done a lot of work in this space here where, we all know that periimplantitis is becoming a bigger and bigger problem. And a lot of that is due to immediate implants that are placed, or, when bacteria go towards the roughened portion of a dental implant, which they love. And so even if you try and get, as best you can primary closure, or you try as best you can approximate, the tissues against a healing abutment, for instance, you can never prevent a little bacteria that's 5 microns in size from going towards the roughened portion of an implant. And this poncho technique has really helped out a lot. And, of course, PureF helps a lot with soft tissue healing. And so when you look at this, bacteria would have a really hard time going to the implant surface. And so we've done a lot of work in this space. And here's a little short video of what this looks like. So this is a PureF membrane that's been folded in half. I did this video here with Dr. Nate Estrin, a periodontist that I've done a lot of research with and a close friend of mine as well. And we teach this very frequently, actually, in implant courses. I do a lot of work today. In fact, this weekend, we had a course with a really new and exciting implant company that I recommend people learn more about their surface topography. It's called OsseoPure. It's a company in Buffalo. And I did a course with Shivan Patel and Dr. Matt Lasorsa where we use PRF in implant dentistry. And for those that would like to learn all the applications and kind of a little more on novel surface technologies that have been pioneered more recently, there's been some very exciting discoveries that have been made recently in that space. So you can learn about that if for those that are placing dental implant. The name of the company is called OsseoPure. Now, for me, we do a lot of work with recession coverage. I work with a lot of periodontists as well. And years ago, we would start to use PureF to treat recession coverages. Now, this is more, bigger cases probably. This is the Vista technique that was pioneered by Homa Zadeh and some of his postdoctoral students, Dr. Allam. And, of course, you can't use this for all cases. You need a band of keratinized tissue, otherwise you would need a connective tissue graft. But there are certain cases, and we teach this in our perio courses, how to do these types of procedures. So it's very, very exciting. Cases like these where people have mild recessions, they're much better off getting treated before they get much worse. And these are quite easy procedures to do with two little vestibular incisions once you know what you're doing, how to do the technique, and have the right instruments. And that's a course that, it's one of my favorite courses to teach where I get to host my previous supervisor from Switzerland, Tony Scullion. He flies from Switzerland, from Zurich all the way. He takes a direct flight to Miami, and then we do the course at Nova Southeastern University every single year. In the intra-bony defect world, same thing. A lot of work's been done in this space. Historically, we would use PRF to do surgery. And again, as things have gotten better and better, we try and avoid surgery more and more. So this is what was done 10 years ago to treat intra-bony defects with PRF. But today, we're much bigger into lasers. And this whole field of laser technology has improved dramatically where we can improve cal gains, so clinical attachment levels and pocket depths. But a lot of laser companies will actually use the laser to generate heat to make a stable clot. And one day, I was with one of my supervisors and I said, why are we using the lasers to make a clot when we know how to make super clots? And today we'll actually make PRF and tuck them inside the pockets. Amazingly, when they go in, you don't need to use sutures or other things. And this is something that we delegate to our hygienists, and we'll charge $295 per arch when we add these types of techniques in. So it's been very, very exciting. Again, yeah, the optimization of PureF. I don't want to get into all the details. For those that would like to learn more, on the BioPureF website, we have a lot of videos that cover, what fixed angle versus horizontal centrifugation is, the benefits of one versus the other. So it's a, basic research. I don't want to get into too much details regarding that, but I just want to say that, there's been pretty significant advantages going horizontal. When we spin fixed angle, the problem is when you spin, you bunch up all the cells against the back walls, and it's very hard to separate them. When you go horizontal, you can much more effectively do that, and you generate, up to 4 times more cells and growth factors. We actually have discounts on this webinars for those that are interested in getting a BioPureF unit, where if you've never seen this, the tubes still go in up and down, but as it spins out, it flies out horizontally. And this is what we call horizontal centrifuges. People have asked, is it worth getting this? How many times more effective is it? It's about 4 times more effective than regular fixed angle centrifuges. So that was the work that we did in 2019. In fact, my paper on horizontal centrifugation is the most cited paper on PRF or PRP in the past 10 years. So it's probably been the biggest discovery. And instead of going fixed angle where we bunch all the cells up against the back walls, we go horizontally and we get a much more effective separation. There's been randomized studies and there's been systematic reviews, which is really the highest evidence base. We published this paper up to December 2024, so it's getting a little outdated here, 2 years old. But even back then, 85% of studies showed favoritism for horizontal centrifugation, 15% found no difference. And the main reason why was the studies were just not big enough. So sometimes when you do studies that only compare 12 patients between two groups, there's not enough significant difference, even though the results are better. But majority of studies show clear advantages for horizontal. And since the year 2019, that's the only way that we spin and make PureF in most of our practices. So these are the three protocols that are typically used for separation on the BioPurif system. So for those that would like to learn a little more, we teach all this in our courses, but generally in a nutshell, the 700 RCF protocol for 8 minutes is the one that we use for solid PureF. That's our dental use. In fact, if you're a dentist and you do dental surgeries, that's the protocol that you can leave your machine on pretty much every single day. In the facial aesthetic field, sometimes we'll spin for the 300G for 5 minutes. That's a smaller layer separation, but it's more concentrated. And then, of course, with the CPRF protocol, it's a bigger separation. We use that for the ALPURF because when we cook, we don't want to kill, quote unquote, too many cells. So we actually like to spin faster, push more of the cells to this buffy coat zone. That's the area right above the red zone. Then we can pull out this upper layer here. We cook it, then we cool it, then we mix back in this layer here to prevent cell damage. So there's all kinds of protocols that have been pioneered. Of course, when we teach PureF courses, I used to teach a PureF course, we've been doing it for many, many years, but 8 to 10 years ago, it was a 1 day program. And I used to have a hard time, creating enough slides to do like a whole day lecture. Today, there's no way that I can teach a PureF course in under 2 days. If you really want to learn all the science behind everything, this is one of the fastest growing fields that we have in regenerative dentistry. There are so many publications published every year. There's more than 500 papers published every year. And so there's just a tremendous amount of new knowledge every year that comes out. And it's just made the courses more and more packed with information so that we can really optimize this technology for all of our patients. The last technology, of course, is what I showed with Dr. Talik. So I just want to show you guys, if you've never seen this before, one of our courses would be a great one to learn. We teach about the bioheat in all of our courses. So if you take a dental course and you want to learn, we teach this everywhere. Of course, we teach how to make the biofillers in all of our facial courses as well. But if you've already done PureF for several years, I would highly recommend not taking the beginner program and going towards the hard and soft tissue symposium, the course that I teach with Dr. Sculian, because that's where we're going to go through the more advanced techniques such as the bioheat. So by the time that you enter that program, it's like you already know how to do blood draws, you already know how to make PureF, you already know the basics, you're doing sticky bone in your practice, and now you want to take it to the next level and you want to start to incorporate these technologies for to replace collagen membranes essentially. And so again, just to recap, we drop the upper layer, we're going to cook it, and then this is going to get mixed together. And so that's done. We pass it about 10 times. And then I always tell clinicians when they're doing this for the first time, remember that there's living cells in here. So you don't want to just jam it back and forth forcefully as hard as you can. There's really living cells in there. So you want to do it relatively smoothly, and then we can use it as an injectable. Or in dentistry, we actually started to create custom shape membranes. And the first place that we actually use this, and you can see it's a lot thicker than standard liquid PureF, but the first place that we used this was over top of titanium meshes, because titanium meshes have a high rate of exposure. So here it is, and great application. Of course, master clinicians like Dr. Picos uses it for everything from, basic extraction sites, GBR, but all the way up to very invasive surgeries that most of us probably would never feel comfortable doing, such as zygomatic implants. But all this to say, I mean, this is a huge, huge surgery. And the amount of complications that can occur here is obviously very high. And typically, you'll use buccal fat pads, but that may change the shape of the person's face. Sometimes it's hard to get the buccal fat pad out. If you were to try and cover this with an alloderm, this would cost you thousands of dollars, most likely. Dr. Picos today teaches courses where he teaches people to use the bioheat technology over top and covers this with this all natural technology that you can literally make with 4 PureF tubes for $4. The tubes are about $1.15 each. And so really it's a great way to, utilize these technologies. Other examples where we use it, anywhere we would use collagen. So for instance, over top of our sticky bone, our bone allograft, we'll use it. For those that use PureF, know that the soft tissue heals very nicely. We can use it for horizontal ridge augmentation, just like we would use collagen here. Instead, we can use the extended PureF. So anytime you hear me say extended PureF or ePureF, that refers to the heat created denatured one that lasts 4 to 6 months. And of course, Dr. Estrin has published some great articles on using the extended PureF for lateral window closure. I mean, we've been doing this a long time. I mean, this paper was published here in 2024. The cases were done in 2023. I mean, this is technology that is not new. We've been doing this for 5, 6 years. It's very safe. It's very published. There's many papers online now utilizing this as a substitute for collagen. There's really, when you really understand what you're doing, there's no need to use this technology, collagen membranes anymore. You can utilize and replace it with this technology. Okay. One of the things, apart from the fact that PureF is really great for wound healing, is the fact that, growth factors, and we see this everywhere in medicine today. Everybody wants to do peptides now and exosomes, and they're all talking about growth factor. The field and the understanding of like how you can take small biomolecules and optimize your body, optimize healing, etc., is never ending. I mean, that's never going to go away in medicine. And so the nice thing about PureF is that we're using the intrinsic ability to heal yourself from your own body. And the fact that we can get a kit, which will cost us under $3,000, but once we have the kit, the cost per treatment with 6 tubes and a butterfly needle is about $10. And the standard cost that we charge patients is $295. A lot of insurance companies will cover that. So the actual profit is $285, a 96% profit margin. And it's not just the fact that it's a very highly profitable procedure. You're actually doing something that's really great for your patients. You're going to help them feel faster. You're going to lower complications. And like I said, in implant dentistry, I'm really glad that, we have the team that we have with our implant educators, whether it be with the Picos Institute or with OsseoPure. Those are the two teams that I primarily teach with, mostly. Everybody on all of our teams use this technology routinely. In fact, if a patient literally said like, I don't want to use PureF or I can't afford it and it's not covered by insurance, I would still want to use PureF simply because of the fact that, you know, complications are the worst thing that can happen in your implant dentistry career. And I always tell that to the perio residents that we do trainings with. Complications are the absolute worst things that can happen for you. And so the ability to optimize healing, minimize periimplantitis, improve soft tissue healing, lower pain scores, less likely to take opioids after third molar extractions. I mean, there's all kinds of indications. And the reality of this situation, we actually put this together recently. If you only did 2 PureF cases a week and you charged $295 and only did 2 implants a week or 2 extraction sites a week, you'd be adding $28,000 of profit to your practice. If you did 5 treatments a week, which is probably the most popular, that's only 5 surgeries, 2 extractions, 3 implants, whatever it may be, you'd be adding $71,000 of profit to your practice. And if you're a heavy hitter doing 10 plus cases a week, that's $142,000 of extra added benefit to your practice, added profit to your practice. So, the BioPure kit is typically $3,450. We have a $500 off starter discount for the BioPure kit. If you type on the BioPure website, August Webby, AUG Webby, you'll get $500 off that. Okay. Now, what I really want to focus on is the use of PureF in facial aesthetics as well, because this is, it's a little unassuming that this field is as big as it is. And when I talk about those numbers in dentistry, yes, it's very profitable. And yes, you're going to do a lot of great things for your patients. But the field of facial aesthetics is just massive. It's literally 20 times bigger in terms of billions of dollars when compared to implant dentistry. And I had never known this in my life. I would have never known this. I would have never thought in my life I'd be working in facial aesthetics. But when I moved to United States and I started to get asked questions like, why are you not teaching Pure F courses in facial? And people would always ask me, and I had the American Academy of Facial Aesthetics ask me about using Pure F instead of PRP for microneedling and all these things. I realized how big this field was. And I was shown these exact slides in 2019 by Quintessence, who wanted me to write with a plastic surgeon a Pure F and facial aesthetics book. And the full implant dentistry market is a $4.6 billion a year field growing at 9% per year. Um, all of dentistry is a $25 billion a year field growing at 6.7% per year. And this facial aesthetic field was a $31 billion a year field going to 119 billion by the year 2026, growing at 21% per year. This was the projected size of each of these markets in 2020 and what it would be in 2026. And sure enough, last year, the field of facial aesthetics passed $100 billion in 2025. It actually grew faster than anybody would have expected in 2019 because of COVID. And when people started to see themselves via Zooms, more and more people wanted Botox and they wanted to minimize fine lines and wrinkles. And they were staring at themselves in the cameras on big screens and be like, oof, I don't like the way that this looks or that looks. Now we say people are most critical about themselves, and it just exploded. And what else has exploded has been the the treatment plans that go into facial aesthetics. And I want to explain this. 15 years ago, it was really cool to have big lips, filled cheekbones, and look fake. It was cool to look like Angelina Jolie. And you had bigger lips than you should have had, and you had bigger cheekbones than you should have. And it was a sign that you had money and, you were walking around like, I'm a celebrity, like, this is what we do and this is cool. And people would try and imitate that. And many people took that way too far. And when we look and we fast forward 15 years later, we look back at a lot of those photos and we say, man, that looked really, I don't want to say stupid, but it looked stupid. And we've realized today that people don't want to look fake anymore. There's been a whole movement of like holistic everything. There's been a whole movement of, I call it going green. And people want to look like themselves just 10 years ago. They don't want to look fake. In fact, they don't want you to know that you've had anything done. And so our ability to use all natural regenerative therapies, with Pure F and with energy-based devices like lasers, the advantage here is you can't make people look fake anymore with those technologies. You just reverse the aging process in a more natural way. And that's what we're very, very good at Care Aesthetics. And that's where my research team has really done a lot of work, because never forget that it was a dentist that invented PRP. It was dentistry that invented Pure F. It was dentistry that did all the research on Pure F and PRP and improved things. It was a dentist that invented the ALB Pure F and the biofillers and the Easy Gel and the this and the that. So, we're really ahead of the curve in that space. And, our ability to transfer and have all these tools in our dental practice that we use for dentistry every day. And now there's, I think there's 42 dental boards that approve dentists to do facial aesthetics now, and eventually it's going to be all. If you're in one of these states like California or Texas, the worst case scenario is you have to pay a medical director $1,000 a month, let's say, to be your medical director, and he's got to live 100 miles. At Care Aesthetics, we teach people how to do that. We've got care doctors in every single state in the country, so you're allowed to do it. It's just it costs you a little bit more, but compared to the profitability you can make, it's still very, very worthwhile to do so. And as the field has gotten, more and more popular, one of the things that's been very crazy is that Botox just continues to cost more and more money. And the crazy thing is, especially me being born in Canada, a lot of Canadians can buy the same Botox I buy for $5.50 in US for like $2.50. In other parts of the world, Botox is like $1 or $1.50. And they literally have, I don't want to say ripped us off. They've done a great job. It's a multi-billion, trillion-dollar company. They just know that Botox alone is an $8 billion a year industry in the United States alone. Implant dentistry is a $5 billion a year worldwide industry. So Botox in the United States alone is a bigger industry than all of implant dentistry in the whole world. And the same thing with fillers, the overhead of these materials is very, very high. You can see in both cases, it's around close to 50%. And there's been studies that have been published by Allergan and others that have shown that the average person, when a person says, yes, I'm going to enroll and do Botox, the average person will do 40 units of Botox every 4 months and 2 syringes of fillers and spend on average $2,740 a year, right? Some of our patients are 30 years old and do Botox twice a year, spend $600 twice a year and spend $1,200. Others will get 5 syringes of fillers and Botox every 3 months and spend 6,000. But the average person is spending close to $3,000 a year. So, knowing that and knowing that's the demographic of these patients that are 30-plus-year-old, mainly females in the United States, if you can somehow convince them to go away from doing that and doing more regenerative facial aesthetics, or just decrease how much of the Botox and fillers you do, add in some regenerative therapies, because guess what? Today, all the celebrities, Kim Kardashian, Jennifer Lopez, Beyonce's, Shakira, all of them are all doing regenerative facial aesthetics, and they've got videos galore all over the internet to promote this stuff. So the great thing is that we know that the celebrities have shifted that way. We have a lot of that equipment in our dental practices. Let's start to do more and more of those therapies ourselves. And so Catherine Davies has been a great influence on me personally, but also within our organization at PureFEDU. She is the lead instructor for our facial aesthetics department, and her and I teach a lot of the courses. She did a great job writing this book, PureF and Facial Aesthetics. And if anybody wants a copy on our BioPureF website, we have discounts on these textbooks. And probably the simplest thing you can do is doing microneedling with PureF. And you're going to see all over the internet, you have all these YouTube videos and Instagram videos with Instagram influencers, what they're called, where they just talk about how great this procedure is. It's a very easy procedure to do. In fact, it's so safe that you can delegate it to your dental assistants. So it's super, super safe. An esthetician can do it as well. And all it is little tiny needles that are going to push the growth factors into the skin. And it was discovered by accident. It's kind of a crazy story, but many years ago, there was an African American lady and she got into a car accident and they scar white. And so she was this, attractive lady, had a scar, and unfortunately her scars were all white. So when she would walk in a room, it was very obvious that, something had happened to her. And the plastic surgeon tried to reproximate the tissues and do all these different things and could never get it fully right. So one day he just said, you know what, I kind of give up on trying to do different procedures. I'm just going to tattoo black ink into your skin to fix this white line. And he did that. And when she came back a week later, she looked so many times better. Instead of having, this black skin and white line across, it was nice and smooth. But she went to the plastic surgeon. She said, doc, like I'm feeling my scar here. My scar used to have this ruffled border. My scar is nice and smooth now. Like it's nice and smooth. And the plastic surgeon looked at the before and after photos and realized, yeah, the scar is a lot smoother. And he hypothesized it was actually the needling that broke up the scar. And so he did this very well-known study where he did many, many patients. He tattooed all of them, all these patients of different ethnicities that had scars, white people, Indians, Asians, African Americans. He did all this study, tattooed all of them with no ink. He just wanted to see if the needling would fix the scars. And sure enough, it did. And that's what led to the discovery of the Dermapen, the microneedling device, where you have 12 little tiny needles that are going to push and do needling all at the same time. Now, the nice thing is unlike getting a tattoo, which might be more painful, obviously, we're doctors, so we can get our patients fully numb. And then over the years, they said, well, if you put ink into the skin at a depth of 1.5 millimeters, the ink will stay there forever. What if we start putting things that are good for the skin, such as vitamin C, builds collagen. They did that, it worked better. And then they said, what about hyaluronic acid, which is going to hydrate the skin? It worked well as well. And then when this whole PRP, frenzy was going across America and all fields of medicine, a doctor one day said, what if I microneedle the Pure F into the skin and the results were glowing? And so what he did thereafter was he did the split face studies, many studies, microneedling with vitamin C on this side, microneedling with PRP on this side. Every study showed that the PRP side was superior. He called it a vampire facial, and next thing you know, it blew up in the United States. And now many patients know what a vampire facial is. They know what microneedling with PRP is. And so our ability to get these devices, which are really not that expensive, and use them for high profitability in our practices is really encouraging. And so I'm going to talk about that and how we've incorporated that as the basis of things that we do in our field. Okay. So you're going to see in this video, she's going to be using hyaluronic acid. She's not a doctor. The video is a little bit silly. Like I said, I just took it from YouTube, but she's going to be applying hyaluronic acid on the skin first. And then she's going to be doing 3 passes with the microneedling pen to push the product in the skin. She's not a doctor, so she's not using any topical cream. It's still tolerable. You're going to hear her say, like, it's not painless, but it's still tolerable. And she's going to talk about the benefits in anti-aging. And if you look at her, she's got great looking skin. She's in her mid 40s. I'm sure she's tried everything. She's going to talk specifically about the benefits of the microneedling with different types of growth factors that you can use in your practices here. So I'm going to go ahead and play this little short video here.
Absolutely sterile needle. I always show people that it's still sealed in the package. Not that anybody would ever think I'd reuse needles, but yeah, that's just super important. This will get used on my skin today and it'll get put in a sharps container and disposed of. So that's super, super important. Sanitation is huge with this, you guys, because obviously you're sticking needles in your face. So I'm going to cleanse my face, and I am actually going to swab my entire face with alcohol again, because it's so important that there's nothing on my face as far as makeup, sunscreen, moisturizer, none of that stuff. So what I'm going to actually needle into my face today is hyaluronic acid, my medium weight pure hyaluronic acid. I happen to love it. Okay, here I am once again with my fabulous hairdo and, you know, the whole nine. Completely clean skin, and I've taken an alcohol wipe and finished that off. Here I have, again, my hyaluronic acid. So the way that I microneedle is I have a pretty planned out. I'm going to start here, and I can dial up the millimeters that I want here. So that's pretty awesome. Now I'm going to start over here, and I'm going to do about a square inch, and I go down, across, and then diagonal through that square, and then I move on. This ensures that I get everywhere. I'm going to get pink. I might get some pinpoint bleeding, and I'm going to have to keep applying my hyaluronic acid. And because I'm using HA, I'm choosing to also use water because I want to drive the water and the hyaluronic acid into my skin. Now you can see, you guys, I'm surviving this. Does it hurt? It doesn't feel like a party, but it's totally tolerable. I have not used any numbing. When I get close to the eyes, I stamp a little, I don't grab. Depending on your practitioner, some like to get a lot of bleeding. I am not of that philosophy, but that's a personal choice of the practitioner. I feel like some nice flushing, maybe a tiny bit of pinpoint bleeding, and that's fine. That's good to go. Good results will happen. And I didn't have to, you know, hamburger up somebody's face. Today, I'm going to be
Okay, so that's the procedure in a nutshell. That's the DermaPen device. Amazingly, this is usually a $5,000 device or so with all the starter package tips, etc. We have a great relationship with Dermapen. In fact, since they know that BioPureF is the number one PRP PureF company, they actually teach their courses with the BioPureF units, and we extend our BioPureF discounts to them, and they extend their discounts to people that take our PureFEDU courses. So for anybody that would like one of these devices, you'll see on their website, it's usually for the 30 packs around $5,000. We get it only as a show special, or for anybody that's on our webinars, $3,850, and that gives you enough to do 30 cases. The average cost to do microneedling with PRF in the United States is $700. You do 30 cases, that's $21,000. I can't think of anything that will make you more money in your practice than this little tool here, where you buy a device that's less than $4,000, very popular. Many people are doing these treatments, and it turns into $21,000, and it's recurring revenue. And then you buy the next 30 pack for $900, and that it's $30 per patient to do a procedure that's $700, and you can delegate the entirety of the full procedure to one of your dental assistants. So honestly, it's one of my favorite devices that I have in my practice, without a doubt. And so we'll show here some microneedling. This is from the textbook, Microneedling with Platelet Concentrates here. You can see big improvements in fine lines and wrinkles. We've done thousands of these cases between all of our care doctors today. Fine lines and wrinkles, forehead lines, these are great techniques that work extremely well. We've since done lots of research on acne, and you have to remember that this is an active infection. And so our ability to super concentrate leukocytes that fight infection and use it on, whether it be elder patients with acne or more commonly young people, teenagers that have acne, we're able to do a lot of these treatments where it works quite, well. I would say 80 to 90% of the cases get cleared up. And you're doing a really good service for these young people by not putting them on Accutane, which not only is not so great for, your kidneys, livers, etc., but also there's links of Accutane and depression, suicide, etc. So our ability to do this in a very natural way, doesn't take very much time. The procedure's 5-10 minutes, really, really valuable. At Care Aesthetics, this is a lot more advanced, but we're well known for what we call a bio refresh or biocare protocols, where we do a combination of intraoral lasering, extraoral lasering, PRF papule injections, microneedling, and then biofillers. We do this all in the same session. It takes less than an hour. In fact, I ran a course today where we probably did 15 procedures in my office today. It was a lot of fun. Earlier in the day, we had all these doctors fly in from around the country as far as Washington State. We actually had some people coming from Vancouver, Canada as well. And it's just a great protocol, all natural, doesn't cost very much money at all. And the regenerative outcomes are great. And you may not necessarily start with a laser right away, and you can certainly do this with other laser types like Photona or Cyton. But the CO2 is the one that's the fastest. And so it just makes things really smooth, fast, takes less than an hour. Intraoral lasering is quite interesting, and we've published a paper on this, on the benefits to treat nasolabial folds, marionette lines, and jowls, where there's certain patterns that we follow that we treat, like smoker's lines, nasolabial folds, marionette lines, and we perform vectors, and the heat from the laser will actually tighten the tissues. This is all done intraorally. So now we're going to be. This is actually the lasers firing, and it's actually treating the areas and tightening the tissues intraorally. So it's very, very exciting what's being done there. And then, of course, we do our standard fractional laser peels, very common. And then we use the PureF and we do mesotherapy. So I wanted to show a little video on this with Dr. Davies. And this is anywhere you see fine lines and wrinkles, for example, around your eyes, glabella lines, forehead lines, neck lines, anything that's not really volume loss, but it's more fine lines and motions. A lot of these same places where you would inject Botox You can use the liquid Pure F in the same area, even in combination therapies where you can do Pure F first and then thereafter you'll do the Botox thereafter. So again, you don't have volume loss, for instance, in your crow's feet. There's no volume there in the first place. You just have a lot of motion from squinting and smiling, and now you've got lines. So one area is just paralyze the muscles with Botox, but a more natural approach is to regenerate the tissues with PRF. And even in combination therapies with PRF, and then a week later doing Botox, that's when you can really optimize outcomes. But again, we teach this in all our more advanced courses. Here's a nice video of Dr. Davies. So I just wanted to introduce her to everybody. If you do get a chance to take our facial course, she's the lead instructor there. So I'll play this little short video of Dr. Davies here.
What we really want to see is we want to see that papule. One, because then we know we're intradermal, and two is because a papule is the best way of stimulating fibroblasts. So creating a papule in that fine line and flooding it with these awesome growth factors such as VEGF, FGF, really just improve the skin tone quite dramatically. As part of our BioLift protocol, we'll be doing a series of 3 a month apart. It's often done along with microneedling, but today Terry's had some laser. We've got some beautiful PRF, very rich in growth factors here, on a Lure Lock needle, which is great, so it doesn't all spray out. And we're going to start with the crow's feet. So I'm going to start this side. I'm going to ask Terry to just turn to the side. That's lovely. And if you're combining this with Botox, we do not do it on the same day. We'll do it a week later. If you do it a week before, then you can't actually visualize the exact lines to inject in. The most important thing is to make sure the bevel is up. If you can't see the bevel, you need to work with loupes or glasses. The bevel being up will give you your papule, so it's very, very important. When working with the eye, always start further out because it's quite a shock to start injecting close to the eye. Although with PRF, we can get really nice and close up to the eye. Okay, so I'm just going to start directly into the fine line. You can check where you are by lifting the needle up. And tiny papule. How do those feel? They sting a bit. Okay. And we just go along each line. Sometimes the papule stays there for a bit and it looks like a bit of a bee sting. Sorry. But they go down pretty quickly. Anything that runs down, you can just wipe in. So there's a papule, so I know I'm intradermal. Okay, lovely.
Okay, so that's very easy to do. It's very, very safe. In fact, they use PureF for eye drops, so there's really no risk there whatsoever. So that's one of the other steps that we do in the protocol. And I would say probably the most important. So we're just going to do a little of all is the biofiller. So have a look at this consistency here of what this looks like.
What it looks like, because it's very different in consistency. Okay, when you look at it, it looks a lot more like almost like fat tissue. Okay, and that's what we're going to inject into our patients. Either we make membranes or we can inject this as biological fillers into the skin.
So that's what's nice about it is that, we can inject under somebody's eyes, for instance, and just literally spread it out like fat tissue. It's very, very safe. You can't be allergic to your own blood. You can't have fibrous encapsulation. You can't cause a vascular occlusion. It's very, very safe. And so, this is a nice example from our textbook of just patients we've treated doing these types of combination therapies with lasers and PureF, which is really, really great. So these are just cases from the office of, people that can have really, really bad, significant wrinkles. You can really improve them over time because you're regenerating tissues. And, we've done a lot of these types of therapies in the offices. And same thing for hair. We used to almost only exclusively do men for hair, but with the whole GLP-1 movement, there's just been more and more females that have ran into hair loss because they take, semaglutide, tirzepatide, etc., and lose their hair from malnutrition. So these are all things that are part of care aesthetics. I don't want to get into too much detail about care here, but essentially what it is at my office, we realized that, we wanted to do more of these aesthetic services. I was first an associate and with Michael Canner, and he knew that the profitability of these procedures would be such that he could make his practice a lot more valuable. He could increase the EBIT of his practice tremendously. In fact, Dr. Canner ended up selling his practice for uh, close to $10 million for a single practice. It was a big practice. We had 16 ops and there was three of us associate working there, but very profitable. And a lot of that profitability came from these aesthetic services by doing all natural regenerative sciences. And I'll talk more about, what he wanted to set up for me. And I still remember the day in 2020 when, I was doing aesthetic services and doing perio cases, but one day he just said, like, I want to go all in. Let's focus on this. The patients are loving what we're doing. They're loving the microneedling. They're loving what we call the BioLift protocol when you do microneedling and papule injections with Puraf and some biofillers, and it costs us nothing. He kept saying, like, Rick, this is so different than implant dentistry. By the time you pay for your dental implant, your abutment, your bone graft, your collagen membrane at that time, and you're working with two assistants, and if there's a complication, you're fixing it and you're swallowing costs. By the time you pay for all that, there's a lot of expenses. And, the normal dental practice usually makes 10 to 15% of total, profit. That was normal, right? The overhead is 50%. The associates are making 33 to 35%. The overheads and the profitability is 10, 15% is the EBITDA. But when we were doing aesthetics, the profitability was more than 50%, even after paying the associates, myself, or even others that were doing these types of protocols. So we launched that and it became very, very successful. So much so that when we were teaching courses in his practice, I'd oftentimes bring in 6 to 8 dentists into the practice at that time. Today we bring more nurses and more medical doctors, etc. But when we first started, we just said, like, hey, you need to come to our practice and see what we're doing. And I remember this gentleman here in Ohio said one day, like, my God, what you guys are doing is just unbelievable. If I did this to my patients and I do the holistic approach and I go more biofillers, I mean, I do Botox. I've taken all the AFE courses and do Botox and fillers, etc. But if I start to incorporate this Pure stuff and I've got the laser already, I think I can really kill it. You guys created a system. Can I just like buy all the banners and trifolders and everything off you guys? And, we thought about creating a franchise, but there were so many complications and, documents and lawyer fees and this and that. I just said, the heck with this. I don't want to do that. What is the cheapest way that we can make somebody another care clinic without it being a franchise? And the way that we figured out how to do that much, much cheaper was to create a license of marketing material. And so that would allow us to give you a license that you could get all the marketing material that we had created, all the banners, all the trifolders, all the videos, all the know-how, all the protocols. We have hundreds of hours of like videos, procedural videos, marketing videos, you name it, it's in there. And waiting room videos, playback videos for your offices. I mean, just everything that we had created. And we would protect that, person in that territory. So they get a 10-mile coverage where we wouldn't put another care doctor close to them. And it became very, very successful. In fact, in the first year that we launched this, where we started our first care clinic in 2021, by April, when we ran our big facial course, there was 22 doctors, a little bit everywhere that wanted to join. And year after year, it just kept getting bigger and bigger and bigger to the point now where we have enrolled more than 250 practices in all states in the United States. And for those that are interested, like I said, I will say, especially if you're a dentist, you have to look the part. So you got to make sure that, you know what you're doing. You can see right from this photo. These are our biggest courses by far. And the reason why I say that is because it is the courses that are most profitable. And what our colleagues have learned is that for those that enroll in these courses, and we'll talk about numbers in a few slides here, there's really a huge advantage to make a lot of extra money. And so for those that want to join, they have to commit to doing 3 courses. And the first one is coming up in November, so it's very, very soon. And again, like I said, if you want to do this, especially if you're a dentist, you have to look the part. You can't just all of a sudden start to say, I'm going to start doing Botox on my patients and just, your patient's going to come in and say, why do I want to do this in my dental practice with my dentist in my dental practice, or what makes you qualified to do this? Even though a dentist knows more about head and neck anatomy than pretty much anybody, especially nurse practitioners and physician assistants. And that's no knock on NPs or PAs, because I have three NPs hired in my practice that help me, right? And they work for me. And the day that we train them to do facial aesthetics and we train them how to do injections, they knew nothing. They don't learn anything to do facial aesthetics in NP, nurse practitioner schooling. But through repetition, through lots of training, through good mentorship programs, of course, they can become excellent. But nobody will ever tell me that the day a dentist graduates from dental school, that they're not more qualified than an NP the day they graduated from dental school, because we've taken a lot more head and neck anatomy, and dentists are expert at doing injections. We inject everywhere into complex areas, bent over backwards, etc., dark areas. And then we have very good tactile skills because of how many injections we do. So what a dentist is missing is really to look the part. So when you walk into either of these dentists here, the practices and the banners are up and they look aesthetic and they've got trifolders and booklets and video playing. The advantage now is that you look the part, and now the patient probably feels a lot more comfortable doing the procedures. So, I don't want to go into too much detail about care because we will talk about this in our courses, but you get a protected territory, you get a ton of marketing material, many different trifolders, banners, and many, many procedural videos, etc., that will help you. And so, what we've really gotten good at is that if the average person is going to spend this much money in the practice, the nice thing is that we can do, these procedures that are equally as expensive. They don't spend more money doing lasers and Pure F. The difference is that they're more natural, which a lot of patients want. And the other thing is that the overhead is almost nothing. The cost of these treatments, once you have the equipment, is very, very minimal, and a lot more profitable. And the nice thing about this too is you have to remember that when a person enrolls and says, okay, I'm going to spend, let's say, $3,000 in Dr. Myron's practice this year, doing 2 procedures with Pure F every 6 months, that's for the rest of that person's life. As long as you keep them happy, you're on recurring revenue, autopilot, right? And so the one thing that I learned a lot, because, I don't have a business background by any means, I learned this from Dr. Cantor, who was, in practice for 38 years. He sat me down and he said, hey, look how easy this is going to be. All you got to do is find 300 patients that are going to spend $3,000 a year, and you've literally created a $900,000 of recurring revenue yearly, every year. You almost created $1 million of recurring revenue coming into the practice every single year. Imagine how different this is than implant dentistry. In implant dentistry, if I charge $3,000 for implants, I got to find 300 patients to do implants on. But then the year after, I got to find a whole new 300 patients, and the year after, a whole new 300 patients over and over and over again. And that's kind of the lifestyle of a periodontist, right? I'm constantly searching for new cases. But in the aesthetic world, if I find 300 patients that are doing Botox and Pure F and lasers, they're doing that every year. So once I find those 300 patients, as long as I keep them happy year after year, my job's done. I just got to keep serving the exact same 300 patients and keep them very, very happy. So it's very, very profitable in that space. And so things that will help you guys out and you'll learn about in the first course: install the care banners. It's going to help you tremendously, raise awareness. I always say, we would do this on purpose. I would treat a staff member like a front desk person. 30 minutes before we opened, I'd come in at 7:30 and I'd just blast somebody's face, make them red, put some Pure F on, make them look very noticeable, so that every single patient that would walk in be like, oh my God, what the heck have you done? And you know what the front desk would say? I just did this amazing therapy with Dr. Myron. It's called the BioCare treatment. It's all natural. It involves lasers and Pure F. Here's a trifolder. Here's our next open house. We have a wine and cheese coming up. If you're interested, please let us know. And it just raised a lot of awareness very, very quickly, because unlike other fields, like, patients are really excited about the field of facial aesthetics. And I can promise you, if you have a 2 to 4 hour loop video playing in your waiting room on a TV. People will be glued to the TV watching, all these aesthetic treatments that you do in the practice. Again, running an open house. So we just help doctors, and we have an entire app, referral program, etc. That's becomes possible with Care Aesthetics. So, it's really the know-how of how to do all these different things. So as I showed this slide, and we're at the very end now, where in dentistry, if you do 2 treatments a week versus 3 versus 5 in the field of dentistry, yes, you're going to add a lot of revenue to your practice doing Pure F in dentistry. There's no doubt many of you guys are probably already doing that. And, when we do the exact same thing in the field of facial aesthetics, the difference is the treatments are a lot more expensive. And not only that, they have to do 2 per year. So unlike if I did 1 implant on a patient, the minute my patient says, yes, I'm going to do microneedling with Pure F, and they want to go into that, just like they do Botox every 4 to 6 months, they do microneedling with Pure F every 6 months, that now becomes a $1,400 patient. And if they do it with the Pure F injections and the biofillers, that's typically an $1,100 treatment. And when you actually look at the same numbers, if you did these 2 per week, 3 per week, or 5 per week in the different fields, like you can add $330,000 of extra revenue by buying a BioPure centrifuge for under $3,000, a DermaPen for under $4,000, and if you just did 3 of these treatments a week, you'd add $330,000 to your practice next year. And so our goal for our care aesthetic clinics, when they join us, we always say, like, we want our practices doing at least $1 million a year of extra revenue. And we've gotten, pretty good at getting them there through years of just learning and what marketing material works and what videos work, etc. So it's been very, very exciting. So for those that would like to learn more about this, and I know we have a giveaway coming up, our next course is November 19th to 21st in Fort Lauderdale. You can find that on the purefedu.com website, and hopefully some of my staff members have put, just little codes there. The coupon code AUG Webby will give you $1,000 off. We have a lot of great vendors that come, so you'll learn a lot about aesthetics. We have big companies that come from BTL, DECA. We've had Fatone in the past, InMode, Morpheus. We also have great partners in the implant dentistry world, such as OsteoPure. If you want to learn more about their implants, a lot of times they come in and do little evening webinars. And so it's a great conference, like I said, that we run. It's our biggest one that we run every single year. And so if anybody wants to sign up for that, you can do that either online on our website, or you can call the PureFedu phone number 954-909-2763 or email info@purefedu.com. So I'm going to let this over. I'm going to turn it over to Scott and Robin, who's probably going to share his screen, and we can do the giveaways to see who the lucky winners are going to be this evening. One person will get a free course, and 3 people will get the free online training program as well to our facial course.
Thank you very much, Dr. Myron. As always, over deliver. Okay. As I said, heart of hearts, he's just a researcher. But I would say more than that, he's a man of incredible generosity. And it's not because he's giving away free stuff tonight. It's because, everything he's ever built, he literally birthed Care Aesthetics out of a desire to help other people. Okay? It was really a matter of, he'd give it all away for free if he could. I won't let him do that, okay? But at the end of the day, we can only reach so many patients through the hands and efforts of others, through the knowledge and experience of doctors like you. You can use what Dr. Myron has researched, okay, studied, learned, implemented, and proven. Okay, you can take it into your practice. So here's what we're going to do. We do have an exciting giveaway. And at the end of the day, what we're giving away is we're giving away an opportunity. Really, that's an opportunity, okay, for you to get to Florida. Okay, to come to the 3-day facial course. We call it the flagship. It's honestly, that's what it is. The flagship course. It's going to revolutionize the way you think about facial aesthetics, how you execute platelet-rich fiber into your practice. And it's truly, it's like a circus, except you don't get to sit in the bleachers, okay? Like you actually get to be in the middle of the show. So I'm going to just tell you for a second about the course, but we are going to give this stuff away. That way you can get the winners out of the way. And the rest of you, okay, can buy your tickets, okay, to the show. But I want to just reiterate a couple things. First of all, you do this because it's best for your patients. At the end of the day, it's not only being on the cutting edge, it's just the efficacy of care. It's increasing the probability of high quality long term patient outcomes. And it is, again, it's what people expect now. Educated patients, and not by degrees, but by research and study of their own, they understand what's toxic and what isn't, what's all natural and what isn't. And they're looking for doctors that are helping them move that forward in their lives. Best for patients. Number two, again, profitable. We all want profitability. And you can buy lots of equipment, you can implement lots of procedures, and most doctors never even know, okay, if they are profitable. Dr. Myron, in a, by the way, a free master class, he just showcased to you, I think it was 2 a week, 3 a week, 5 a week, of your opportunity to implement, what he's teaching and what exactly your return on investment would be. That's powerful stuff. And then the third one is ultimate differentiation. That's what it is, taking your practice to the next level. So you got the discount codes, special savings in the chat. There's been lots of questions coming back and forth. So Robin is going to bring that back up there. I'll be quiet and I'll let him do his thing. Hey, but also, we're going to give you the chance for some Q&A. Dr. Myron's over-delivered once again. We are going to stay for a few minutes, and we will tackle, a few questions, long as they're good questions. And those are the ones that we can answer, by the way. Okay, go ahead, Robin. Are you ready? So you got to be present to win. And Robin is your go-to. Okay, the person who knows as much as anybody other than Dr. Myron. So we'll put his brain like an encyclopedia at the top. He's like an AI computer before AI existed. And next we have Robin. So Robin is going to be your go-to, following up from this master class. All questions, all equipment, all registrations, all care aesthetics license. He will be your contact, and his email is in the box. All right, Robin, who do we got? This is everyone registered, okay, for our master class tonight. All right, is Dr. Maria Escabi is here. You have to be present. You have to be present to win. Okay, well, this is the online course giveaway. Oh, she's here. All right, hooray, we got a winner. Thank you so much, Dr. Escabi. Hopefully I'm saying that at least somewhat close. I'll work on it. Okay, next, please. You're going to reach out to Robin. He's going to set you up. Glyza is here too. Glyza and May, who are our left and our right hand. That's what Glyza and May are. And they take care of everything. Dr. Dennis Sierra. Hopefully I have that right. Hey, Dr. Dennis Sierra. Dr. Sierra, are you here? Hey, we're 2 for 2. This never happens. People love the giveaways, Dr. Myron. We're going to keep this going till midnight if we could do it. Okay, we'll get one more. We got one more. Oh, no, we got 2 more. This is another online course. Giving away an online course. By the way, I've never seen Dr. Myron provide the discount on the various equipment, the centrifuge. All right, Dr. Andrew Zamora. That's a good one. Dr. Andrew Zamora, you here? We got going once, twice. Let us know. Oh, 3 for 3. This is a miracle. Okay, well, the simple answer is, we got one more grand prize. Okay, grand prize. And then I have the best news of the night. Okay, go ahead, Robin. Give us a spin. Isn't this cool stuff? Okay, we get a grand prize. This is a full 3-day facial course in Fort Lauderdale. Dr. Jeremy Montrose. Fireworks and all. Do we got Dr. Montrose still here? This is a full course. Oh, there we go. This is crazy. Well, now they're going to want to do this again. Okay, listen, congratulations to all of you. Thanks for hanging out with us for a full 90 minutes. We're going to tackle questions, but the best news of the night is nobody's left out. Everybody's a winner, okay? Because we're giving you a $1,000 savings off the flagship course. Okay, now anybody you've ever been to an event, you know these things ain't free. All right, but this is a ticket into the park. We want you to come and visit. We want you to experience everything. And I'm going to tell you, and I've been to probably more CE courses than any doctor alive. Okay, and I want to tell you that this is the most magical experience because it's really a two-in-one. You're getting a powerful educational lecture, including from Dr. Davies, okay, and Dr. Myron and other experts, and then you're getting a full day of hands-on. We call this Make Money Monday. That's what we call it. Because what you're learning in the 3-day flagship program, you can hit the ground running with it on Monday. Now, obviously, you don't want to jump ahead and buy the equipment so you can be ready to go. But the point is, it's real-time implementation. You're going to have the most amazing experience. Doctor after doctor says to me, gosh, I've never seen a hands-on course like this. We transform, I'll say we, I'll give all the credit to Dr. Myron and his team, but we transform the conference room into a massive, I don't even want to say clinic, but let's say what it is, a clinical experience. And so this is a very special time. I would challenge you to get in before the year is out and make November the next stop for you and your clinical education. And most important, take your practice to the next level. So, Robin, if you don't mind, Robin's message is here. His text and email is here. Maybe we can put that link in there for the flagship course one more time. And also the masterclass code. I think it's August Webby. All right. Dr. Myron, we're taking questions. Let's see. Thank you. Tell me what. I think
Can I
it's
answer one? Because I just went through. There's a lot of questions regarding medical directors, what you can do in which states, etc. So in most of the states that were listed, this includes Virginia. There was one in Canada, one in Washington State. You're allowed to do facial aesthetics in those states, number one. In the states where you're not allowed to do it, for example, in Texas, they still have a little bit of pushback, so to speak, from the dental boards, which is going to go away, I'm sure, in the coming years. In those states there, you have to hire a medical director. And the way the medical director works is that it has to be a medical doctor that lives within 100 miles of your practice. And they're kind of used as like an emergency in case something goes wrong. That's the same medical director that's required for, let's say, an NP or PA. So any nurse practitioner that opens up, a new med spa or physician assistant needs the same medical director. And you'll see that, I don't want to say they're a dime a dozen, but there's a lot of medical doctors that put their name out there. You can find them online very easily because it's a great job. You get paid $1,000. It's not your license that's on the line, per se, and it's not your insurance. You're just like the scapegoat that's going to try and help out in case something goes wrong. So you can do this as a dentist in all states. And as was mentioned, we have care doctors in every single state. So if you're in a state where you're just not sure, it's very easy. Reach out to our team and we'll provide you the contact details of a similar dentist that's in your state that can help coach you on what they did to make sure that it's legal in that state.
Thank you so much. All right, very good answer. We have a few just quick clinical questions, very cool clinical questions. I'm going to go bottom up. It's a cancer question, Dr. Myron. So, Doctor mentioned about PRP for patients that have not been cancer free for at least 5 years. Is this true? And is there any difference with PRF?
It's the same. The rule of thumb is you need to be cancer free for 5 years, so in remission for 5 years, or you need a note from the oncologist stating that you can do the treatment. So it's the same.
Perfect. Thank you. All of those asking about your city, state, etc. That's the best way to talk to Robin. Do a discovery call. Let him walk you through. There's huge advantage. We're biased, but there's huge advantage to lock up your area to implement aspects of care. It's regardless of state. Like Dr. Myron said, we have in every state. We show the map. Okay, so that's an individualized call that you should have with him. So we have when performing socket preservation, is PRF is used as a membrane barrier. Does primary closure have to be performed, or can it be left exposed?
And no, it can be left exposed. You don't need primary closure. That's been done for years and years.
Thank you. CO2 and relapse of pigmentation.
Every single laser, you have to be a little careful, obviously, with pigmentation. But as laser technology has gotten better and better over the years, the handpieces now have like built-in temperature controls to the point where like it's difficult today to actually burn somebody or cause hyperpigmentation because they're so safe now compared to 20 years ago. So that's not really a problem. And then since we combine a lot of stuff with Pure F, for example, we do like laser peels plus Pure F, we can be a little bit less aggressive on the laser because we're also adding in the PureF as well, where we get better outcomes in the combo treatment. So that's not really an issue whatsoever, although it could be with an older CO2 device. But that's, we go through all that in course number 2, follow the experts.
All right. Thank you so much. Is PRF contradiction in pregnancy?
In facial aesthetics, all treatments are contraindicated in pregnant people. So the safety is there. I was actually explaining this today. I was asked the exact same question. It's very, very safe. So there's no issue treating a pregnant person. The issue is the following. There's a chance that a pregnant person could have a miscarriage at any given moment, right? So they're just probability wise, there's a chance you can do pure F microneedling today, and then in a day or two, they can have a miscarriage and they can be completely unrelated. But of course, when that happens to a female, they blame it on the facial aesthetic treatment. That could be Botox, PRF, anything. So for that reason, you should never treat somebody that's pregnant in facial aesthetics.
Yeah, that's great. Thank you very much for sharing. We'll finish up with two more. We got a simple one. Would a PRF filler last as long as Juvederm?
It lasts 4 to 6 months, whereas Juvederm will last 1 year. But the one thing that we found, and I'm 100% sure of this because we've done it so many times, when you ask a patient, we can inject you once per year with a chemical filler that's going to break down your tissues over time versus do 2 injections with 100% all you, and we'll do it every 6 months. 95% of patients will say, inject me twice with my own stuff. That's no big deal for me. And they'd much rather go that way.
That's great. That's fantastic. Let's see, what about HIV patients?
No issue there. In fact, a lot of HIV patients have a lot of volume loss and they actually like these more natural approaches. The HIV drugs are so good nowadays as well that HIV levels the virus is very, very low, almost non-existent. So, it's very rare, let's say, that we do those treatments on HIV patients. But of course, we treat every patient like if they did have HIV. Obviously, it's the same in dentistry, but there's no contraindication whatsoever, like if it was a cancer patient.
Okay. This is specific. We have 5 millimeter tubes with the horizontal rotor centrifuge machine. Is it okay to use your protocols with small tubes?
No, no. The
Oh, you
reason
got the best. Throw that thing out.
No, that you can't do it actually. The reason why is that the way that the protocol is designed is that it takes into account the RCF min of the tube and the max of the tube. So whatever that difference is, that's how the gradients separate, and the clot is going to be formed at what's called the RCF clot. When you start to use bigger or shorter tubes or different size tubes, it throws off all the calculations. So it's not that you can't use that tube. It's just that the protocol has to be completely changed and recalculated on a different size tube.
All right, awesome. Thank you, Dr. Myron. Can PRF can you use PRF for patients taking anticoagulants?
Yes, definitely. We do it all the time. In fact,
Would you
it'll help
would
them clot faster.
Great. Would you not do microneedling if you're doing CO2 fractional lasering since you're already perforating the
No,
skin?
no, we like to do them together. In fact, we prefer to do them together. And we found that patients not only have better outcomes, but they heal faster in combo treatment. So it's one of the things that's proprietary to Care Aesthetics is combination therapies with lasers and PRF.
Yeah, that's awesome. Awesome. Fantastic. Proprietary, my friends. Yeah, you've heard the Myron protocols. You've been enlightened and empowered. Now it's your turn to act. Okay. We have a few other questions. We'll be happy to handle those tomorrow morning, Wednesday morning. We want to make sure that you have that discount code, which will go away rapidly. We really encourage the best thing to do is to get to November. The flagship course is, it's the starting point. Dr. Myron did mention during the master class, if you have advanced experience within the PRF for a certain period of time, you could leap to our advanced training. He also gave us an example of his very famous, okay, follow the experts that he just was doing yesterday and today. He's still going tonight after 2 full days of doctors in the office, okay, just for you. So I want to say, number one, November, okay, your team's going to love it. Okay, it's going to be profitable, okay, and you're going to get the hands-on experience. You're going to find something that your CE course, you come back home and your team is more excited than when you left. Have you ever had that experience before? Mostly they're skeptical. They want one more thing to implement. They're going to be on fire for this, right? Secondly, we have the special savings on the centrifuge to kick things off for you. And third, if you're interested, which I don't know why you wouldn't be, if your area is available, which there's a good chance it may not, okay, talk to Robin about care. Don't wait for November to do that. It's very important, especially if you're already moving the direction or you have an aesthetic or cosmetic or an implant based practice. This is the perfect thing to move it to the next level. All right. It's been a lot of fun for us. I hope it's been a lot of fun for you. I think you've had a great time tonight with Dr. Myron. And I'm going to leave you with a quote, because I always do, and I'll give the master final words. It's a great quote for Dr. Myron. It says, follow what you are genuinely passionate about and let that guide you to your destination. Well, we can see what he's passionate about. We hope tonight he's rubbed off on you. Hey, if you are passionate about regenerative dentistry, you're passionate about doing the best standard of care for your patients, you're passionate about taking your practice to the next level of service and impact, and hey, it's okay to say we're passionate about being profitable, making a lot of money and being prosperous, especially when we're doing good. Okay, if you're passionate about all that stuff, you found your home. Okay, jump to our 3-day facial program in November. It's the next best place for you to be. We have online courses in the meantime. Talk to Robin about care aesthetics. Dr. Myron, I'll give you the last word.
No, it was exciting to see meet everybody that I've not met in person here this evening, and looking forward to see people in the November program or at a future course. So, um, yeah.
Thanks, everybody. Great job. Have a good night.